So in relation to all the hands-on techniques, and I think you're starting to get confidence with that now, and I think you're moving away from the massage and getting into the pin and stretch. Are there any of them that you got a surprisingly good result with?
I think the one that I use more often, especially for low limb, is the hamstring. I think as well, if most people tend to have, if they've got like a low limb injury, a positive posterior knee stability test as well. So it's good to get in that hamstring because straight away, as soon as you retest it, that knee stability comes back again.
Yeah, nice. Yeah.
And I love being able to see that as well because then they can see it and you know that you're doing something right.
Yeah, you always get that reaction from the patient when
Yeah,
they're like shocked, you know, it's like, I think, but automatically, like that's powerful because like you massively, your trust has just gone way up, your authority's just gone way up because you've changed something, and even if their pain hasn't changed, they'll see that as progress, and you can build on that then as well, and I think that's really good. I think the real good thing about that is it's quite quick to change. So not that the pain is quick to change, but that we can change those tests really, really quickly. And if we can show how quickly we can change those tests in the first session, we can massively increase our buy-in and our confidence in the patient. No, definitely. How have you found the hands-on in general?
I think I did one the other day with a guy. I was doing like the QL, then I struggled with that a little bit more. When we've done it with Amy's tiny and it's a lot easier to find the muscles with her, but I think I really struggled with this guy because I think it was quite chunky around this side.
And I suppose that I do a lot around, like say if I'm working on that area, I'm more towards like frontal plane obliques and stuff because it's a lot easier to get to those myotendinous junctions. And I think when you're going off bony landmarks, so if I'm going off the pelvis or I'm going off the bottom of the rib cage, that's a lot easier than trying to get into these deeper muscles like the QL and stuff. And I suppose even if somebody is, you know, overweight and stuff like that, if you're going off, if we're just trying to get the myotendinous junction, it doesn't make that much of a difference. It's still harder. Whereas when you're trying to sink through other tissues, it's definitely harder. So yeah, exactly, and just being able to be desensitized. But no, definitely. I think that what I find about the hands-on, definitely when I first started doing this kind of treatment, is it massively saves my hands. So I think if you can find the right way to do it, you don't have to do that many reps. You're kind of breaking it up with rehab in between, and you're not killing yourself with it. It's rather than pushing and compressing, it's all about load and elongation. And when we're doing our hands-on, we're not trying to press into tissues. We're trying to restore tissue's ability to take load through it. So we're just literally putting a load through a tissue, giving it that kind of sensation, taking load through it again, letting the sensory receptors adapt to that, and then that's going to help us then when we get to our next stage of rehab, that those tissues are going to be able to tolerate load as well. I suppose over the last 5 weeks, what are your biggest wins so far, Sarah?
So I had someone in recently actually, and it was literally like a textbook assessment. So he came with a low limb, which I was most confident with anyway. Everything that he went through from like the right at the beginning, I was kind of expecting to see certain things on the bend. He showed it as well. So my effective explanation went really well. We were dead happy with everything. Managed to get some hands-on stuff done as well, and and that improved his results as well, so I'm really happy with that.
So almost the hypothesis that you formed after the subjective was confirmed by your objective assessment. You were able to explain it really well to him, he bought into it, and you were able to do treatment and get the result. And that's, if it happened with every patient, we'd be laughing. That's really, really good. And I suppose in terms of the actual content itself, and how are you finding that now? So I know at the start, obviously there was a lot to take in, especially week 2 and 3, there was a lot of new stuff there. How are you finding it now, a few weeks in?
I'd say it was getting to the point where it's more enjoyable now because you've got the basics of it, and it's just kind of learning bits to add on to the foundations of the stuff that you've already learned. If that makes sense.
Getting a little bit of a deeper understanding of it as well. So at the start, and this is what everybody goes through. I think at the start it's very superficial. You're kind of just learning the techniques, but wrapping your head around it. Whereas now when you get to week 4 or 5, you're starting to really actually understand the stuff from week 2. Now it's like that actually makes sense why that's important.
I just can't believe it sounds mad, but at the beginning I knew nothing. And I know I've obviously got my degree behind me and stuff, but I knew nothing compared to what I know now. And I would never, the person that I had in the other day, I would never have ever been able to have him walk through that door and me assess him.
No,
I would never be
yeah.
able to do that.
Yeah.
Ever. I wouldn't even know where to start.
Yeah, and I think a lot of that is, I think you would have been,
Yeah.
but I think it's confidence.
No,
And I think,
totally
yeah, but I think it's almost like because
Yeah.
you didn't have a system, because you
Yeah.
didn't have your own
Yeah.
clarity on what
Yeah.
you're looking for and stuff like that. When you have a system to follow, and again, it's a very flexible system depending on the patient's with.
Yeah.
When you have a system to follow, you kind of it takes away that kind of fear of the unknown, what's going to come in. You're kind of
Yeah.
confident whatever comes in, I'm going to be able to make sense of it.
Yeah.
And I'm going to be able to kind of figure out,
Yeah.
even if I don't know exactly what it is, I'm going to be able to treat what I find and I'm going to be able to make a result. And it's just having that confidence that no matter what walks through the door, no matter how complex or easy it is,
Yeah.
obviously if it's complex it's going to be harder, but you're still confident you can assess it and find out what's
Yeah.
going on.
Yeah.
Whether you get to the bottom of it in the first session when you just start or not, you're still confident you can treat it and
Yeah.
at least get a result and be able to explain it to the patient. That's important as well.
I try not to like overthink things. You know, if someone comes in and they've got one little thing that's making me think that it's not what I think what it is, or if that makes sense.
Yeah.
I kind of overthink it and I'm like, no, it's not that because they're showing this or something instead. Or
Yeah.
I don't know what it is, I try to kind of distract myself from thinking what I know it is.
Yeah.
If that makes
And,
sense.
yeah, no, and definitely. I think it's important to have a hypothesis from your subjective, but you're always going to keep an open mind. And you know, I'm often proved wrong.
Yeah.
I often think one thing when they're telling me something when they sat down,
Yeah.
telling me the subjective, and then I get on the bed and I see something completely different.
Yeah.
That's fine. I've changed my hypothesis now. I've updated it. I've confirmed it's actually probably rejected that hypothesis, and now I'm going to move on to something else because this is actually now. And then as long as that makes sense to their story, and as long as all the rest of the assessment findings fit into that, that's fine. And and again, that's the beauty of a system is you'll never trip up because you're not just relying on one piece of information. Each time and each progression you do, and each time you go to the next part of the system, you're either backing up or else you're throwing away your last hypothesis or last thought of what was going on. And by the end, by the time you've done a full assessment, you're going to have not just one thing, but at least 5 or 6 different things that are pointing towards the same problem. And then that's giving you a lot of confidence in terms of where I'm going to start my treatment, rather than thinking, no, I found that in the subject and I have to treat that. But if all the objectives pointing somewhere else, again, let's say someone's coming in and saying, my knee's really sore, but if all your objective is pointing to an ankle, you're going to desensitize the knee, but a lot of your rehab probably needs to be on the ankle. And if that links back to the story where they had an ankle sprain 6 months ago before this problem started, now I've got a lot of confidence that actually this is an ankle problem and the knee is just taking the brunt of the stuff instead. But yeah, no, I think it's a really good point.